You will go on YouTube, search asphyxia forensic medicine in one shot, and then you'll find a one shot video, probably not this one, some other video. And then when you get into the video, you'll find that the lecturer has started the lecture from hanging. Again, you'll search for another video. In another video also, the lecturer has said 2-3 words about asphyxia and then directly into hanging. Without being taught the concept behind asphyxia, you are being done injustice to. So before getting into the various types of asphyxial deaths, you need to understand first the concept behind asphyxia. What even is asphyxia? What are the types of asphyxia? What are the clinical signs of asphyxia? And what is the mechanism behind those clinical signs? So before getting into asphyxial deaths by hanging, strangulation, suffocation and drowning, first I'll teach you the definition of asphyxia, the various types of asphyxia, the clinical signs of asphyxia and the mechanism behind those clinical signs. Starting the lecture with the definition of asphyxia. Definition. So the word asphyxia can be broken down into two, A and asphyxia, where A stands for absence and asphyxia stands for pulse. And that is why the word in Greek literally translates to pulselessness. But then the actual definition of asphyxia is defective aeration of blood. See, this is how the aeration of blood takes place. Here's the respiratory tract, and the end portion of respiratory tract is the alveoli, which is surrounded by capillary. So in between the alveoli and the capillary, there's your respiratory membrane. It is at the respiratory membrane that oxygen enters the blood and the carbon dioxide leaves the blood. If there is any impairment or pathology at the site of ventilation, or at the site of perfusion, or at the site of exchange, or at the site of central nervous system or the center of respiration, then it will eventually lead to defective aeration of blood or reduced oxygen of blood, and that is referred to as asphyxia. So asphyxia, it is characterized by two things. It is characterized by two things. Number one, decrease in oxygen in blood. And number two, increase in carbon dioxide in blood. So there is less oxygen but lots of carbon dioxide. This is referred to as hypoxia and this is referred to as hypercapnia. So in asphyxia, you have a combination of hypoxia and hypercapnia. So finally, what is asphyxia? Asphyxia can be broken down into A and asphyxia, where A means absence and asphyxia means pulse. So in Greek, it literally translates to pulselessness. By definition, it is defective aeration of blood which can be due to pathology or impairment at the site of ventilation or at the site of exchange or at the site of perfusion or at the site of respiratory control center. It is characterized by two things. Number one, hypoxia. Hypoxia means a decreased oxygen in blood or the inability of the cell to utilize oxygen. And number two, hypercapnia, which means increased carbon dioxide load in blood. Done. Number two, what are the various types of asphyxia? Now, the various types are on the basis of causative agent, which is also referred to as asphyxiant. On the basis of what causes asphyxia, you have the various types of asphyxia. Number A, mechanical asphyxia. As the name says, in mechanical asphyxia, there is mechanical obstruction to airflow. I will not give you any examples because throughout the lecture you are going to learn about lots and lots of mechanical asphyxia due to hanging, due to strangulation, due to suffocation and due to drowning. Number two, traumatic asphyxia. So traumatic asphyxia is due to pressure on chest. For example, in case of stampede, when lots of people are running over you and stepping over your chest is unable to inflate, your lung is unable to expand, and you are unable to breathe in, leading to asphyxia. Or a fall of building on body during earthquake. So during earthquake, building, it collapses over your body, and the same thing happens. You are unable to breathe, leading to traumatic asphyxia. Another is tension pneumothorax. What is tension pneumothorax? See, in tension pneumothorax, here's your lung, here's the pleura around the lung, and then in between is the pleural cavity. Due to trauma to the lung, the air from inside the lung escapes into the pleural cavity. As a result, the pleural cavity is now filled with air. This air does two things. Number one, it compresses the lung. As a result, the lung is unable to expand. Number two, the pleural cavity normally is a vacuum with little fluid. It's a vacuum with little fluid. Due to this vacuum, there is negative intrapleural pressure which pulls the lung, and due to the negative intrapleural pressure, the lung is able to expand. But once this pleural cavity is filled with air, that negative intrapleural pressure is lost. So the lung is unable to expand. So at the end of the day, the lung is unable to expand due to two reasons. Number one, the air in the pleural cavity is compressing over the lung. And number two, the air in the pleural cavity removes that negative intrapleural pressure responsible for the expansion of the lung. Okay, so that was your traumatic asphyxia. After traumatic asphyxia, you have chemical asphyxia. See, straight up, it's due to poisoning. For example, you have carbon monoxide poisoning. You know very well that the hemoglobin in your blood has a large affinity towards carbon monoxide as compared to oxygen. So if you get poisoned with carbon monoxide, the hemoglobin is going to leave the oxygen, go attach with carbon monoxide, and there is decreased availability of oxygen to your body, leading to asphyxia. Another poisoning is cyanide poisoning. You know that cyanide is cytotoxic. It works by inhibiting the oxidative phosphorylation responsible for utilization of oxygen to produce energy in mitochondria. So cyanide will go and inhibit oxidative phosphorylation even if there is oxygen. Even if the cell is available with oxygen, the cell won't be able to utilize that oxygen and energy won't be liberated, leading to asphyxia. The rest are opium/barbiturate poisoning. Opium and barbiturate, they are CNS suppressants. That means they will go and act in the central nervous system where there are your respiratory center and suppress the respiratory center, hence suppressing the mechanism of respiration, hence leading to hypoxia and asphyxia. Next is your environmental. Environmental asphyxia is as a result of reduced oxygen in environment itself, reduced availability of oxygen. For example, at high altitude, there is reduced atmospheric partial pressure of oxygen. Similarly, deep in caves or in well, there is more carbon dioxide and less oxygen. So your body receives less oxygen and has more carbon dioxide. Then there is pathological asphyxia. Pathological asphyxia, straight up, it is due to some sort of pathology or disease of respiratory system, either in the tract or the lung itself. For example, glottis edema. When there is edema of the glottis, there is narrowing of the glottis, the air can't pass in. Another, in pleural effusion, the same concept as in pneumothorax. In pneumothorax, the pleural cavity was filled with air which inhibited the expansion of the lung. In pleural effusion, the pleural cavity is filled with inflammatory fluid inhibiting the expansion of lung by two ways. What? Number one, by compressing the lung. Number two, by obliterating the negative intrapleural pressure. And finally, another example could be pneumonia. Why pneumonia? In pneumonia, there is consolidation of lung. That is, the alveoli is filled with inflammatory fluid, and if the alveoli is filled with inflammatory fluid, exchange of gases won't take place. And with that, we are done with the definition of asphyxia and the various types of asphyxia. What are the various types of asphyxia? With the mechanical, traumatic, chemical, environmental, and pathologic. Next, what are the various signs of asphyxia? So you have something called asphyxial triad. So there are three major signs of asphyxia, and they are cyanosis, which is in the form of external finding. Number two, Traudeuse or Bayard spots. They are in the form of external and internal findings. They are nothing but the petechial pinpoint hemorrhages and visceral congestion. Since this is present in viscera, which is inside your body, obviously this is going to be in the form of internal finding. This is your asphyxial triad. After that, there is also something known as asphyxial quintet. So it should contain the triad plus two more signs, 1 and 2. First one is post-mortem fluidity of blood, that the blood becomes thin and fluid, and right ventricular enlargement. Both of them are indeed your internal finding. One is the finding of the blood and the other is the finding of the heart. Again, so you have the asphyxial triad, asphyxial quintet. Others, asphyxia also leads to relaxation of sphincters. And if the sphincters are going to get relaxed, there is going to be voiding of three things: voiding of urine, voiding of stool, and voiding of semen. That is why in victims of asphyxial death, along with the body, you might find voided urine, voided stool, and voided semen. So what do we have? We have asphyxial triad containing of cyanosis, petechial hemorrhage or Traudeuse or Bayard spot, and visceral congestion. Asphyxial quintet containing the triad plus 2, post-mortem fluidity of blood and right ventricular enlargement, and other, that is the relaxation of sphincter leading to voiding of urine, stool, and semen. Little bit of exercise for you. What is this? This is cyanosis, bluish discoloration of nail bed. What is this? This is the Traudeuse spots. Where are the Traudeuse spots present here? It is present in the epicardium. Again, what are these? These are again the same Traudeuse or the petechial hemorrhages. Where are they? They are present in the conjunctiva. So I said earlier, it can be an external finding as well as an internal finding. So right now, these Traudeuse spots, they are your external finding. Where are they? They are all around the eyelids. What is this? This is again your Traudeuse spots. Here, where are the Traudeuse spots? They are just below the pleura, subpleura. And finally, what is this? This is the visceral congestion. In the form of pulmonary edema. Okay. Now you will tell me that I am doing injustice to you guys without explaining you how exactly does a person with asphyxiation end up having cyanosis or visceral congestion or Bayard spots or post-mortem fluidity of blood or right ventricular enlargement or the relaxation of sphincters. And hold your horses. because I'm going to explain to you how now. This is how. Listen to me, you talented piece of people. Okay. First, there is asphyxia. Whenever there is asphyxia, there is eventually hypoxia. By hypoxia, that means there is less oxygen in blood. As a result, there is less oxyhemoglobin and the blood becomes bluish, and this is referred to as where is the slide going? This is referred to as cyanosis. There you go, the very first clinical sign, cyanosis. Second, if asphyxia, I repeat, if asphyxia is due to, I wanted a straight line. If asphyxia is due to neck compression, that is somebody compresses your neck and then you get asphyxiation. In that case, along with the neck, what is also being compressed? What is here? What is superficially here? There is jugular vein. So the jugular vein also gets compressed. There is compression of the jugular vein. With compression of the jugular vein, there is reduced drainage because you have obstructed the jugular vein. So the blood from the head and neck does not get drained. You have obstructed that draining pathway, okay? Reduced return. But the arterial supply is normal. Arterial supply is normal. What else causes reduced drainage? Okay, I said if there is asphyxia due to neck compression, there is also compression of the jugular vein which leads to reduced drainage. But what if asphyxia is not due to neck compression, it is due to some other mechanism? In that case, asphyxia will lead to abnormal breathing. Let's say it's a case of stampede or a wall has collapsed on you. You will try to breathe, you are unable to breathe. There is too much pressure inside the intrathoracic cavity, or maybe there is a case of choking, that is, a food has lodged in your respiratory tract. You will try to breathe, you are unable to breathe, you suffocate, there is too much intrathoracic pressure. So there is abnormal breathing, and there is changes in intrathoracic pressure, and that will eventually lead to the same thing. That will also lead to reduced drainage. Okay. Now, see, here is your capillary. This capillary is receiving normal arterial flow, but at the vein side, it's blocked. That means the venous drainage is not there, but then the oxygenated blood is continuously going. So lots and lots of blood will pool into the capillary, which will increase the hydrostatic pressure and build up pressure inside the capillary. There is increase in hydrostatic pressure, and this increase in hydrostatic pressure will lead to the rupture of the capillary rupture. Another you can understand right here. See, hypoxia, you might already know, leads to peripheral vasodilation. With peripheral vasodilation, there is stasis, and stasis also results in increased hydrostatic pressure, eventually leading to capillary rupture and your Troud's spots. Okay, fine. See, first there was neck compression. Due to neck compression, the drainage was inhibited, but then the arterial supply is still there, leading to increased hydrostatic pressure inside the capillary, and then the capillary bursts. Simple. Stasis also leads to, if the stasis is inside visceral organ, it also leads to visceral congestion. That's your third sign. So with this, you are done with the asphyxial triad of cyanosis, Troud's spots, and visceral congestion. Now we have the quintet, the two others. So first was postmortem fluidity. Due to asphyxia, there is increased fibrinolysin. And if there is increased fibrinolysin, obviously there is more fluidity of blood. There is increased fluidity of blood. Second, hypoxia leads to peripheral vasodilation, but you must also know that it leads to pulmonary vasoconstriction, which eventually leads to pulmonary hypertension. And when there is pulmonary hypertension, there is increased resistance in the pulmonary artery. So the right ventricle has to contract harder to push the blood inside the highly resistant pulmonary artery. And the overworking of the right ventricle leads to right ventricular hypertrophy, also referred to as the right ventricular enlargement. Right ventricular enlargement. So now you also have the two quintets: increased fluidity of blood and right ventricular enlargement. Finally, due to asphyxia, the muscles they lax. Muscles lax or relax, and the sphincters they relax. Sphincters relax, and that is why there is voiding of urine, stool, and semen. And that is how each of the signs of asphyxia are precipitated. This is the pathophysiology or the mechanism behind each of them. Are we good? Okay, now we are good, right?